Good morning, good afternoon, good evening from wherever you've joined us. Thank you very much for joining into this information session hosted by MLD Community Care. This is typically the community that we serve. You can see a lady walking barefoot with her most likely grandson also barefoot. But the important thing is that both of them look very happy. These are other pictures or views of the villages, boys and girls, instead of being in school, looking after the livestock or fetching water for the family. And the population is predominantly peasants, farmers. So they're all busy in their farms. Dr. Dhawale Trust's mission is to provide homeopathic medical care as well as education and research. And the idea is to ensure this in a very cost-effective manner so that we are able to serve the poor community that we are aiming to serve. We serve approximately 200,000 patients every year. Over the years, we must have served more than 5 million people, including 50,000 of them in the non-health initiatives that we undertake. We operate from a variety of locations across the country, 3 main hospitals that we have, and several different formats of clinics that we have, staffed with medical, paramedical, nursing staff, as well as the 48 barefoot doctors who are our community health workers in several villages that we work. Our predominant line of pathy that we provide is homeopathy. However, for the inpatient care, we have to also provide the allopathic cares. These are some of the services that we offer. Mother and child care, cataract, intensive care units, dialysis, senior citizen care, and so on and so forth. Multiple services that we offer through our hospitals. We've been recognized by several institutions and bodies for the excellent service that we provide, which is a recognition of the quality of the service that we provide in spite of being a charitable hospital. These are kind of constitute the holistic community care that we take, whether it's education, whether it's research, whether it's economic development, and a variety of other healthcare activities that we operate into. The focus of the trust as well as the MLD community care is to reach the unreachable. That is our primary motive, and we're all driven by that. And hence the mission of MLDCC is also to support holistic care through health and through livelihood programs. We have 2 main centers that we're going to be talking about today. One is in the city of Palghar in Maharashtra, and the other one is in a small village called Bhopoli, about 20 miles from Palghar city. We'll now talk about the care on the move, which is basically the mobile clinic that we have, which operates into 17 villages in the area that we operate. And to talk about it further, I will hand over to Dr. Sujata Koda.
Thank you, Sunil. Today I will be talking on the care on the move provided by our organization in these setups. To begin with, I would like to share a case of a pregnant woman. She was pregnant for the 3rd time. Her first baby had died at 6 months of age. The second pregnancy had got a termination at 3 months. So this time when the lady was pregnant, the health worker motivated her to get registered and complete her checkups at the mobile. Because of her constant care and support through the 9 months, this lady delivered normally, but her baby boy weighed 4.6 pounds. So she continued giving her support and motivation and orientation about how to breastfeed the child properly, as a result of which the 6 months of age the baby was weighing around 18 pounds. You see, this is one only example. You see, there are many such women now who are looking happy because of their healthy babies. So how is it possible? This is just possible because of the first important component of the care on the move that we provide, which is the community health worker. She is the woman from the community who is trained for the aspects of health, hygiene, homeopathy. She's trained to take care of the pregnant and lactating women, the children, as well as the general community. Here you see a health worker is checking the blood pressure. You see that she's monitoring the growth of the child by checking the weight of the baby. And she's also orienting the community about what should be eaten, about what is the diet, about what care needs to be taken to the general population. Now, this is the second important aspect of the care on the move that we provide, which is in the form of mobile medical unit. You see, these are the vans which are medically equipped. Doctors accompany the vans, and the health workers get the patients to the van, and they are examined, and they are given medicines whatever required. So, because of this, we are having this mother and child health program in place, and due to the health workers and the mobile medical unit, we are able to conduct this program successfully. The aspect of the child care, second one, is the malnutrition, which is a big problem in the community. Here you see that the worker is examining the child, checking the height of the baby, and the doctor is seen to check the papers and advice for the treatment which is needed. As a result of these interventions, you can see that this is again one more example of a malnourished child, and you can see the before and after picture. Before, the child was malnourished, and with the intervention and the care and orientation given by the community worker and the doctor, the child has improved. The grades have improved. So, this is overall impact of the care on the move that is provided on the mother and child health sector. So, the antenatal care, which was very low, has gone to 90%. The institutional deliveries has gone to 95%. The average birth weight has gone from less than 2 kgs to 2.6 kgs. The child malnutrition, which was 65%, has come down to 35%. The anemia in the community, in the pregnant women, has reduced from 65% to 30%. Secondly, we are also providing the health checkup camps and awareness meetings in the community so that their general awareness about the health and what they should do when they fall sick improves, their health seeking behavior improves, and the general community gets benefit of the healthcare services. The adolescent girls is one important factor of the community. These girls are usually having anemia as a problem. So they are oriented, their hemoglobin is checked, and whoever is found anemic, they are given treatment in which they are given iron tonics as well as the homeopathic medicines. As a result of which you are able to see that there is an improvement even in the anemia of the adolescent girls. And recently, the experience of the COVID pandemic, I must share with you. Because our health workers were there in place, they were able to promote the COVID appropriate behavior. They were able to ask the community to wear masks. They were able to tell them that whoever is falling sick should come and get admitted. So they were also able to detect and intervene. And the most important aspect of the work of the community health workers was in the prevention of the pandemic. The vaccination drive, which was going on at a very mass level, we were able to see that in the adjoining villages where our workers were not there, the success rate was very low. Whereas in our area where the workers were in place, because of their continuous motivation, we were able to see that 80 to 85% people got vaccinated, and that is how the prevention of this pandemic was we were able to achieve. So this all goes to prove that good healthcare shouldn't depend on where one lives. It doesn't depend on where one lives, nor does it depend on their financial conditions. So, having said that, we need to understand that the health is dependent on so many other social factors, and we need to improve them in order to improve the overall health of the community. Our organization has been having these interventions in place. I would request Dr. Chandrasekhar to explain the interventions about the enhancing the social health. Thank you.
Thank you, Dr. Sujata. I shall now focus on the other areas of our community center activity. three main areas, next slide, three main areas that influence all-round health in the tribal region are poverty, illiteracy, and farming. Farming, which is their main source of the livelihood. We have been working in this area for the last 15 years or so. The original traditional practices of farming gradually got converted into fertilizer-based farming for larger yield, which as a result gradually eroded the soil, which led to deleterious effects on the health. Orienting, motivating, and reorganizing farming practices to the organic processes needed a lot of effort from the trust. Initial few years were spent on gaining the trust of the farmers and demonstrating the organic effectivity of organic process. Please remember, this change from fertilizer to demonstrating organic process takes a lot of time. We have now successfully trained more than about 100 farmers, and the program is now in the hands of the farmers itself with very little supervision from the trust. The trust also provided a direct connection between the farmers and the consumers so that the farmers got a better price for their yield. In the process, the trust learned a very important lesson of economics of farming, which is very useful for life. IIT Mumbai did a research program where they determined the role of organic rice in improving the hemoglobin of the tribals. Thus, we were able to scientifically demonstrate the use of organic farming in improving health. Next, please. So these are the activities which have been done in the organic farming. Next. So that is how we provided the market, and these were the activities. Yes, yeah. The next activity is the promoting of indigenous Warli art. The trust interacted with the artists and grouped them to make them function like a team so that each of them could achieve more. The trust provided them with market connections here again, and the artists became entrepreneurs. This initiative has also been handed over to the artists, and now they are gradually managing it. Like any other economic activity during the COVID process, this activity also faced difficulties, but now they are gradually picking up. Next venture, please. The next initiative was empowering women through microfinance through the self-help group activity. The basic concept is to work with below poverty line women to develop mutual trust, support, and cooperation to achieve economic successes. I'm going to share the story of a self-help group to demonstrate this particular process and the challenges faced during this. This is of a village called Wheelshed, which was situated on a hillock 1.5 kilometers from Motorable Road. There was water scarcity to the extent that many of the villagers used to skip bath for 2 to 3 days, leading to hygiene issues and health issues. Alcoholism was rampant in the village, and it was very poor income. So in this village, 20 ladies from 20 families were selected to form 2 groups. Unfortunately, only 2 of them could sign. That was the level of their literacy. They had never been to a bank. Farming was the only, farming of rice was the only activity, no ragi. There was a poor health awareness. Next, please. From this, we have now, over a period of 8 to 10 years, brought them to a state where they are now saving monthly. They have got loans from the bank. They have stopped taking loans from money lenders. They have started cultivating vegetables, ragi and pulses for their own individual consumption as well as for sale. They got cooking gas from government schemes. They started going to the banks, maintaining books of accounts. They became much more confident. They also got drinking water facility with the help of another organization. They got educated and oriented for health issues. Thus, we see that the self-help group activity contributed to overall health and economic progress of the village. Next, please. The next activity on which we have been working is the education. Since 2008, we have been focusing on the various steps which we have followed with. We began by coaching in maths and English, which were the main subjects in which the children used to fail. From there, we have now progressed to programs like Discover and non-formal education. We have developed mobile libraries which would go into the schools and fields and provide books for the children to read. And so the reading habit was inculcated in the children. We have been working on integrated approach to technology in education since technological advances was very important. Information technology programs were necessary. Computers and tab-based activities were introduced, and now many of the children are very comfortable in handling tab and computers. Skill building was an important program which we have focused on, and there is now a bridge course which we are focusing in. During COVID time, so now we are working in almost 74 schools and covering about 12,000 students in Vikramgarh Taluka. During COVID time, next please, we faced a major problem of the education program getting behind because of the lack of facility. These are the programs which were conducted. Next. So these are the educational programs which you see. So because of the COVID, we had to reorganize the entire program where we tried to get other teachers to run another program. When we introduced teachers who had to be taken for the program, we saw that basically BSc, B.Ed educated teachers also were very poor in their basic concepts. So this was the level of difficulty which we faced. Next. So we focused on teachers who were our students over a period of last 15 years. Now they became teachers, and we organized a program called DISHA, which is called Developing Integrated Strategies for Students Holistic Approach. Now the students who were under our training program volunteered to become teachers and take up this challenge of dealing with the COVID-related backwardness which had happened. So now this program is working with our Vidyarthi Mitras, it is called, or friends of students, and it has really reached a beautiful. We have finished about 6 months to 8 months in this program, and it's going on very well. Next, please. So this is the team with which we work in all these areas, and this is all what I have to say as far as these activities are concerned. And now I would request Dr. Anand Kapse to please continue and give us information of the inpatient related activities at Palghar Hospital. Thank you.
Greetings from Dr. ML Dhawale Memorial Trust Hospital, Palghar. We are a 100-bedded multi-speciality integrated hospital offering homeopathic and allopathic services. And we have NABH accreditation for both these services. We offer a number of special homeopathic OPDs along with general homeopathic OPDs, and most of the level 2 allopathic services, investigations, and supportive services. We have wards, special and deluxe rooms, 4 operation theaters, ICU, NICU, special care unit. We also have a ward for psychologically disturbed patients and for bedridden senior citizens. 24-hour casualty service, trauma care, and round-the-clock ambulances. This hospital was started in the memory of our Guru, Dr. ML Dhawale, who was an MD physician and an eminent homeopath. So we have tried to create a model of integrated services where allopaths and homeopaths work together. So we have ICU, NICU, dialysis center, which was the need of community for more than 2 decades. And I'm happy to share with you that in the last 8 years, we have completed 51,000 dialysis centers, 80% of which are offered free to the poor patients. Our hospital has a well-equipped orthopedics OT with laminar airflow, which can offer spine surgeries as well as joint replacement surgeries. And since last 1 year, we have started offering laparoscopic surgeries. This is a geriatric center managed by homeopathic physicians, where people with paralysis, dementia, Parkinsonism, etc. offer homeopathic and nursing care. Again, this is an area of big charity. Ours is a green campus, 3-acre green campus, which offers all the support services like occupation therapy, speech therapy, physiotherapy. Our psychiatry department manages chronic psychiatric conditions as well as conditions like alcohol withdrawal in the Anukampa ward. In the last more than 2 years since the time COVID epidemic struck, we stood by the community for our COVID as well as non-COVID services. 50% of the beds were converted into COVID and 50% continued to offer all the emergency services without a single day's interruption. Our team showed great determination and resolve in working under extreme risks, and we were able to treat 650 patients of moderate and severe COVID in our COVID unit. We also distributed 2 lakh bottles of arsenic for prophylaxis, and when the immunization became available, we, along with our Bopuli Center, vaccinated 45,000 individuals, out of which 35,000 were free. In the last 6 months, we have been implementing community-based project supported by Oracle. We conducted 42 camps, reached out to 5,000 rural and tribal patients, and conducted and diagnosed their conditions, initiated their homeopathic as well as allopathic treatment, conducted endoscopic surgeries as well as cataract surgeries. And I am happy to share that Oracle has decided to extend this project by 5 more months. There are many such projects that our hospital is currently implementing with multiple corporate social responsibility initiatives, under which we are offering charitable services, in free investigation services, free dialysis services, subsidized NICU and ICU services. What I realized while working with this hospital is that even though we are 100 kilometers away from Bombay, we are surrounded by people who have very little money for their health care. So we have been the medium for connecting people who want to help others with people who need that. And that is the reason why I am sharing all these experiences with you. Our hospital and my colleagues who have been managing this hospital are known for their integrity, transparency, and 100% utilization of the funds given by the donor, and ensuring that the end beneficiary, the money reaches the end beneficiary through appropriate service. This hospital is a teaching hospital. So one of the outcomes is that the students of MD Homeopathy who work with us, they get exposed to good clinical training, homeopathic training, and they develop sensitivity towards the sufferings of the poor patients. So wherever they go, most of them get involved in some charitable activity, in some service to the poor and needy. I wish that all of you join these efforts and extend your support and help us serve poor and needy more and more. Thank you.
We will now deal with our activities in education and research. The Dr. M.L. Dhawale Memorial Homeopathic Postgraduate Institute is a privately funded PG alone institute in this country, and it is now in its 22nd year of existence. We have an annual intake of 36 for the MD program and 10 for the PhD homeopathy program. We are recognized as a premier homeopathic PG institute, and we impart holistic training so that our students become sensitive healers. We offer integrated health care in the community and the hospital, and learning by doing is the motto. We are able to see our students getting involved in community activities. There's a screening in camps which are going on. They also visit the villages in order to understand the patient. We are able to see a lot of community activities in the field of school health and child health. And of course, in the hospital, we have a lot of facilities. What we see is the newborn intensive care units where our students are getting trained, as also in the outpatient department and in the inpatient department. Knowledge acquisition is through discussions, through PowerPoint presentations, and through a library referencing. And the library is a good, well-equipped library. And in all this, we believe in 3 parameters. Our thrust is in patient care. Patient care leads to education, and both of them together will give rise to research. Let us now look at what we have been doing in the field of research. We have been there in the field of research since a long time, in 1975, when we first did path-breaking research in the field of leprosy. And we were able to show that a lot of changes which are considered to be irreversible in leprosy, we were able to reverse with the homeopathic treatment. Subsequently, we have been doing a lot of research training for undergraduate, postgraduate, and PhD scholars. We run research workshops to train research and researchers in research methodology. And we have a lot of research collaboration with national and local bodies. What you see here on the right-hand side is a joint project that we had run with the National Institute of Homeopathy, where we surveyed the homeopathic services provided by the Panchayat and Rural Development Department of Government of West Bengal. And we came up with suggestions of how we can improve the services. Over the past 20 years, we have done a number of extramural research projects funded by the Ministry of Ayush. What we have done is work on diabetes. We have worked in the tribal areas in the field of scabies and diarrhea. We have also done work in educational in schools, where we have done, again, a path-breaking work in the management of learning disabilities through homeopathy. This was another extramural project which was funded by the Ministry of Ayush. School mental health has been one of our abiding features, and we have published and we have researched on school health activities. The 2 right-hand side dissertations that you are seeing are the dissertations which have been done by the first batch of students in school mental health. We have also worked with the National Institute, and we have devised a research course in methodology in homeopathy. So we have had these 3 booklets which we have brought out, and we have crafted a course through which homeopaths can be trained in research methodology. And we try to publish a work. This is our Journal of Integrated Standardized Homeopathy. It is a publication which has been in September 2017. It's a quarterly publication, and we are listed in abstracting partners. We are trying to get ourselves listed in PubMed and in other reference areas. So this is the work that we have been doing in the field of education and research.